Good morning, British Covidians, on day 61, the start of another week. A rather quiet Sunday morning. I've been up since about 7:30. Very sad to hear today of a young baby who was only a matter of practically, I think, days or hours old or something, who died of something related, or at least COVID-19. My thoughts go out to these parents. Well, to get straight on with COVID-19 and where the massacre is continuing and how herd immunity is subsequently being established. Yes, we spoke yesterday about the return to schools on the June the 1st. We spoke yesterday about how the right-wing press are now demonising teachers and putting them out there as a roadblock to the return of our children who desperately require educating. Whether it is safe or not, clearly teachers are now being demonised, like junior doctors were demonised when they asked for a pay rise. So naturally, as you would expect, the media turning on the teachers. But ask yourself, who owns the media? Who controls the media? And your answer is simple. The Tories. Of course, they own all these companies and they need you back at work. But more importantly today, the killing fields of our care homes. We hear already of stories where people have been sent back to die, effectively. Residents of care homes sent back to die. Sometimes they are lucky and the hospital is even able to spare them some masks to take back, but usually not. Hospitals are having to just hang on to what PPE they've got. Care homes mostly have none, or what they do have is ineffective. So once again I say this Hancock thing about throwing a protective ring. I think of a sort of life belt on Titanic, this big life belt, or this one of these rings that you throw into the water if somebody is drowning. I think they're called a life buoy. Yeah, no such thing. Yeah, somebody writes on here, care homes were left without testing. I cannot stress that enough. Without contact tracing, without PPE, without support. I said this yesterday, yeah, same tweet. You can deny it all you like, Matt Hancock, yeah? But that is the truth, and it is still the truth. They're trying to scapegoat somebody. Could even be now that we're being scapegoated for getting the virus because we're a fat population. That could be the next thing, couldn't it? Because Johnson wants to tackle the obesity epidemic. When has he ever wanted to do that before? Right, what else do we get? Chucky Mark, please just look at this, okay? It speaks for itself. He's holding up a copy of the Sunday People. I don't know whether you agree with that paper or not, but please just look at it and let it speak for itself, okay? Chucky Mark, thanks for bringing that to our attention. I hope people will see that for what it is. I hope they'll take it to heart. That is 15 people returned to a care home to die. Our killing fields. Nobody knew if they had been infected or not because they were not tested. These people sent back, ordinary, everyday, perhaps elderly, perhaps health impaired people, sent back to die. And from what people report, dying without oxygen, dying struggling to breathe. It doesn't just happen instantly. It happens over time. It is a horrible death. Look at this, what I was just talking about earlier. Yeah, 1 day's supply of masks. 1 day. Hancock, you're lying. You're not getting this stuff through to care homes. They have become Britain's killing fields, and naturally you're lying, as you always lie, on the figure of overall deaths. If you look at the Financial Times, taking data from the ONS, so far over 61,000 people are dead. Nothing like the figure the Tories are quoting. What else have we got on here? Just looking through the care homes again. It says on here, while individual care homes await delivery of more face masks, the local hospital, that's in a particular area, has made a gesture of providing each discharged COVID-19 patient from care with just 20 face masks. It said this is an act that will help care homes await delivery of face masks, which it acknowledged is needed as soon as possible in care settings across the country. Set that in context. In care settings across the country. James Cook University Hospital is doing what it thinks is the best it can do, and even at a stretch it's been giving these supplies out to help the situation. In most places, people are being sent back without any kind of PPE at all, and those council trusts are just doing what they can. Okay, so, it says also on here, this is from Squawk Box, forcing hospitals to send infected people back into care homes with no means of containing the virus is going to infect residents and people caring for them. It's the equivalent, now please listen to this, it's the equivalent of pulling a pin on a grenade and throwing it into a room full of elderly people. This is basically what the government is doing. Their failure to start preparations, note that part, to start preparations when they had the opportunity is killing people. And their failure to prepare now is going to kill even more. It's unforgivable. Of course it is. Of course it's unforgivable. They've had time to prepare. They're not even trying. They're not making any effort. Just think again, yeah? People are dying in these care homes. In what, I think it was a senior consultant in A&E medicine or something, might have even been in ICU medicine, as described as unpalliated agony. Right? Think about it, yeah? Because that could be your nan, your granddad, your mum, your dad, with a very serious disease that has meant that they have to be in a care or a nursing home. That could be them struggling for breath, trying to call your name and failing. Struggling for breath. People have described it as like trying to breathe through a straw. Trying to breathe through a straw underwater. Could you imagine what that feels like? Can you imagine the panic welling up deep inside you? You take, obviously, we all do, breathing for granted. That simple inflow and outflow of air, we take it for granted. We're not even aware that we're doing it, of course we're not. But struggling in the last moments of your life as your brain and your internal organs are shutting down, as all kinds of chemicals are firing off inside your brain. Imagine your last moments like that. That's what the Tories are doing. Unrelieved, unpalliated agony. Can't even stop the pain. I'm going to leave it there for today. I hope you won't send your kids back, no matter how much the media will shame you into doing it. Remember, the public schools are opening in September, possibly. Still a case of sending our kids out there, canaries down the coal mines, back to the educational chalk face, before anybody sends their kids back from the top part of society. Yeah, they're using your kids as test cases. Don't let that happen. And just to conclude on one final thing, this will have cost, COVID-19 will have cost the government billions, yeah? But they pay 200 billion, 300 billion, 500 billion bailing out the banks last time. 500 billion bailing out the banks last time. Estimates are that this will probably cost them about 69 billion. 69 billion compared to 500 billion bailing out the banks. Guess who's going to pay that 69 billion? Tell you for one thing, it won't be the banks, it won't be the rich, it won't be the powerful, it won't be the well-off Tory voters living on their private islands, capital tax dodging generally, gravy dribbling down their chins. They won't be paying. The sick, the old, the disabled, those unemployed, those unable to work, the weakest in society, will be paying, if we haven't already paid now, with our lives. Bye.